Taylor. I'm a nursing student at Southwest Tech, and it looks like I have some physician's orders to do asepsis wound care today. I'm just going to go ahead here and close the curtain for privacy. Can you go ahead and verify your name and date of birth for me?
Joe Smith, 10/5/53.
Perfect. And then do you have any allergies?
Sulfa.
Alrighty, and that looks like it matches here, so I'm going to go ahead and wash my hands and put on gloves. And then I would give my patient pain meds 30 minutes prior to doing their wound care, just so they aren't feeling any pain. And I would have assessed their pain level beforehand as well. Alrighty, so with my gloves on, I would come over to the patient and, whoops, not pull that out, but hold it up, and using the push-pull method, I would take their old dressing off. And then I would note the color of the drainage and the amount. So if it was like a straw-colored drainage, it would be serous. If it was bloody, it would be sanguinous. If it was a mixture of the two, it would be serous sanguinous. And then if it had like pus in it, it would be purulent. Alrighty, so then I would wash my hands or take my gloves off and wash my hands again and discard the old dressing. And then I can come over to my stuff over here. Before I get started, I'll just go over the 9 sterile technique principles. So there's a 1-inch border around the sterile field that's not sterile. You must have sterile guard to touch sterile field. Limit the time that the sterile field is open. Fluids flow in the direction of gravity. I had to think of my analogy. Honesty, if you broke sterile field, know it and say it and know how to fix it. Don't turn your back on a sterile field. Sterile water in a sterile bowl only. Nothing below the waist is sterile, and then skin is not sterile. Alrighty. I'll roll up my sleeves here. So then, alrighty, and then go ahead and open my sterile bowl. Discard that. There's a lot of tape on this.
I'm sorry, it's so little and there's so much paper towel. I'll let you wrap them next time.
Just when I think I'm getting there, I'm not. What?
That's all.
Yeah.
There they are.
Alrighty. Then I can go ahead and not do those yet. It's a little close to my edge, but I actually didn't touch that side of it, so. If I really wanted to, though, I could just get a new towel and start over to be safe. don't mind me struggling here. Before I forget, I would have been checking the expiration and integrity of my packages too, so they are not expired and they are in fact still closed and intact. Alrighty, and then I don't have a garbage can near me, but because my sterile water has been opened, I would dump it out in the garbage can first before dumping it into the bowl. And then I make sure that the label is in the palm of my hand, so there's no chance that the sterile water could drip on it and damage the label, so that you can no longer read it. So again, checking the integrity and the expiration date, and it is not expired. And like I said, it has been opened, so I would dump it out prior to dumping it into the bowl, and then I'm going to hold it 4 to 6 inches above my bowl. Whoops. Alrighty, so now that I have my gloves on, I can touch and rearrange all my stuff in here. Okay, so I would go ahead and take my gauze and get that wet with my sterile water. And then I would go over to my patient, and I'm going to sacrifice this hand to hold the tube while I clean it. So I'm going around the wound clockwise and not crossing over where I already went. And then I would discard this, and I would just throw my pickups too, because they're now dirty. Pretend I didn't pull that out. And then now that the wound's cleaned, I can assess it. So I would be looking at the color of it, the location, know if the tissue appears to be healing or not. I can also see if it's draining actively at that time, and then if there's any odor with it as well. And then now that this hand has been compromised, I would just put it behind my back so I don't feel the need to use it. And then I grab my split gauze and come over to my patient and put that on sterilely. And then grab my ABD and place that over top, and then I would tape down the dressing. And then that part of it would be complete, so I could take my gloves off and wash my hands, and then I would ask my patient if they needed anything else, because I do have time, and thank them for letting me do this, and then go document this assessment appropriately.